Hello, everyone. My name is Laura Haraka with Feel to Heal Wellness, and I am a mind body chronic pain coach, somatic experiencing practitioner, and breathwork facilitator. And my goal is to help people free themselves from a life of chronic pain using mind body tools while developing self compassion, self love, and self worth, and just empowering people to know that they have the ability to heal themselves. So it's my pleasure and honor to introduce to you today Dr. Howard Schubiner. Dr. Howard Schubiner is an internal medicine specialist who has worked in the field of mind body medicine for 20 years. And he has published over 100 articles and spoken and lectured internationally and nationally. And his work has been a huge and significant impact on how individuals and healthcare providers have just basically addressed chronic pain issues in this world and country. So he's also had a direct influence on my healing. I was so fortunate to stumble upon his book, Unlearn Your Pain, and I found myself reading it and I just saw myself basically on every page. And then after I healed, I took his Freedom from Chronic Pain practitioner program where I could now help other people heal from chronic pain. So if it wasn't for this man right here, I don't know where I would be and a lot of other people would be. So thank you so much for being here with me today. Welcome, Dr. Schubner.
Oh, thank you. It was a very kind words. I really appreciate it. And, I think the whole point of our work is to empower people with the knowledge and the skills to free themselves. And so it's really important that you're taking all that knowledge and skills and helping others. That's fantastic.
Yeah, thank you. Thank you. So I wanted to do this interview with you because there are so many books and studies regarding back pain and other psychosomatic conditions. And pelvic pain is getting a little bit more, it's being more spoken about lately, but it's really a vulnerable part of the body. And some people are still, it's hard for them to talk about, and they're suffering in silence. So, what I wanted to do was bring a little more attention to pelvic pain today, all those areas that are a little bit harder for people to talk about. I see vulvodynia, pudendal neuralgia, things like that. And to be honest with you, when I was healing from this condition, it was really important for me to hear from a doctor, one that was an expert like you in the area of mind body conditions, to know that this is something that could be a mind body condition. It just gives a little more validity to it in my for me and for people that I help as well. So I a lot of people out there just want some reassurance too that pelvic pain can be and is TMS in some cases, but we do have to know that everyone should go to a doctor. They should make sure there is nothing structurally wrong or there isn't a physical problem going on in their body. So, without further ado, I want to just start getting right to it. So, is the pelvis a common area for TMS?
Yeah, it's amazing how well, TMS, or what Dr. Sarno called tension myositis or tension myoneural syndrome, which we call mind body syndrome or just mind body conditions, because everyone gets mind body conditions at some points in their life. It's part of being human. And so when there's stress in our lives, when there's emotional situations in our lives, our brain reacts to that. And our brain creates what we experience. So when there's a stressful day, our brain might give us a headache to say, hey, it's a stressful day. When we have to speak in front of a big crowd, our brain may give us a stomach ache. But when the stress is greater or longer or long lasting, it might cause almost any symptom. So it certainly can cause pelvic pain. And there's so many conditions, as you mentioned, that are distinguished by medicine as being separate conditions, but in actuality, the vast majority of people have chronic pelvic painful conditions do not have a structural problem in their body. And we know that from lots of studies. And we also know that people do, as you mentioned, do seek medical attention. And if they don't have an infection, if they don't have a tumor or a mass, then 9 times out of 10, it might be called pudendal neuralgia or pelvic floor dysfunction or interstitial cystitis or vulvodynia or coccydynia. But all those conditions are really just different names for things that are painful or uncomfortable or have urinary frequency, etc. So there's very few things other than, like I say, the tumors, infections that can cause serious pelvic problems. Now, endometriosis is one of the biggest issues that we face because endometriosis can cause people to have pelvic pain. And it turns out that a lot of women have endometriosis without having any pelvic pain. And so when someone and people who have pelvic pain often have no endometriosis. So just because one has endometriosis doesn't mean that that's necessarily the source of the pelvic pain. It can be, but we have tools of helping people to figure out if it is or not. And we can
Okay.
talk about that a little bit more as well.
Yeah. So my question for you is why the pelvis? Why this area of the body?
Well, it's like I say, for one, it's any area of the body. So it can be people's headache, ear pain, stomach pain, mouth pain, neck pain, back pain, stomach pain, foot pain, hand pain. It can be anywhere. And the pelvis is an important area. So obviously, it's an area where there's a lot going on because we're having, we're having sex, we're urinating, we're having stools. So there's a lot that people are using that part of their body every day, all the time. And it's a part of the body that's very symbolic. And so it carries a lot of emotional weight. And it's a part of the body that can be well abused, really. I mean, so many times men or women have had sexual problems or sexual concerns or sexual abuse or trauma or assault, uh, or in relationships that may seem to be dangerous, even if they're not physically dangerous, but can be emotionally dangerous. And so the symbolism of having symptoms in the pelvis can be really, it's very common. So if you're like all of a sudden urinating all the time, symbolically, maybe you're really pissed off at somebody, maybe you're really mad at somebody. I mean, it sounds silly, but we see that all the time. If
It's
you're,
true. I'm big in symbolism. That's
yeah,
it's very
symbolism.
symbolic.
And if you've had sexual trauma, if you've been assaulted or raped, horrible things that do happen to people, way more people than we want or deserve or need, and certainly so horribly and common. But nevertheless, that can set up a situation where the brain learns that that area is not safe, that part of my body or your body or someone's body is not safe, can be damaged, can be traumatized, can be abused, can be victimized. So the neural circuits in the brain can be learned to create pain or other symptoms in the pelvis.
Right. Now, would you say there's so many different types of pelvic pain, right? I mean, there's tons. But would you say this the other conditions, because these are the ones I see the most with people, Tarlov cysts, endometriosis, like as you said already, adenomyosis, pelvic congestion syndrome, and keratin pearls. Can you say that those are in the same category as you're saying right now with the endometriosis? Some people can have them and not have pain, and some people have them and it could be a cause of their pain.
Yes, Tarlov cysts are commonly seen and are usually incidental and not important at all. Very occasionally, one can be very large and may need to be removed. Endometriosis, many women have it without pelvic pain, as I said. Uh, And most of the time, if you find endometriosis, it's not actually the cause of the pain, but in some people, endometriosis can be very large, can be the cause of pain. Um, and it's the same, I forgot what other, oh, and
Um,
adenomyosis, similar
mhm,
thing.
mhm.
Yes, very similar with that. So again, the key is is ruling out a significant structural problem that we know is damaging, an ovarian cancer, or ovarian large cyst that's pressing on something. A uterine fibroid oftentimes are not the cause of pain because many women have them, but a very, very large uterine fibroid certainly may need to be removed. So the first thing is ruling out a tumor, an infection, something that's clearly needs to be taken care of. But the second step is ruling in what we call a mind body condition or a neural circuit problem. We do that by looking at the characteristics of the pain. Did it start at a time of stress? Is it exacerbated by stress? Is it is it in a wide area? Has it spread over time? Did it start without any reason? Does it shift, and is it inconsistent? Is sometimes on the right side of the pelvis, sometimes on the left side of the pelvis? Sometimes it goes to the vulva, sometimes it goes to the coccyx. When the pain is shifting like that, that shows us that our neural circuit's causing it, because a structural problem doesn't do that. Is it triggered by innocuous stimuli? Is it worse with the weather or with cold or with heat? As I said, is it worse with stress? Is it worse after exercise, but not during exercise? So there's a whole variety of these criteria that I call the fit criteria. Uh, and do people have had other mind body type conditions, of course, like migraine or tension headaches, like irritable bowel syndrome, like fibromyalgia, like low back pain, like chronic neck pain, etc. So when you put it all together, it's usually easy to assess. It's usually very easy to understand what's going on when you take the time and you listen to people and you love people and you care for them and you show them that you care. You're not trying to push them into anything or force them into anything, but you can demonstrate that this is what's going on just based on listening to those criteria in the story.
Right. And I know you don't know all of my things that I've had, but I have pelvic congestion syndrome. I have two Tarlov cysts. I have endometriosis, and I'm sitting here with you right now in no pain,
Yeah.
which is amazing to me.
Right,
Um,
right.
s-
Yeah, I think most of the time pelvic congestion syndrome is not due to a structural problem. Occasionally it might be, but most of the time I don't believe it is.
right. Yeah, me either. And I've actually taken your fit criteria that I've learned from you, and I have a pain assessment that people can take right on my website, which is
Um,
great. That gives them a score to see how high they are, to see if it's a possibility that this is a mind body condition with all
that's
your criteria.
yeah, that's awesome. That makes me so happy.
Yeah. So let me ask you a few more questions because I know people have a lot of questions about bacteria in the urine.
Hmm.
So for me, I thought I had a UTI and there was no bacteria shown. Now, some people do get recurrent UTIs where there is a bacteria shown, and some people go even further, dig deeper to functional medicine doctors, and they will find specific bacteria that doesn't come out on a first test.
Hmm.
So I'm just curious if you have any um, thoughts about that, both cases, recurrent and ones that there's these, significant there's bacteria but they're not coming out on a test, and how you help people to stop focusing on those.
Right. Well, certainly men and women can have urinary tract infections that can be painful. These are always easily treated by routine antibiotics. And if you have a UTI, you can have the bacteria tested in the lab and cultured in the lab, and making sure that the that is given is appropriate for that bacteria. And in that case, it will work, it will go away. Some people can have repeated bacterial infections, certainly repeated UTIs, but Again, these are easily treatable. If someone's having chronic pain and then the urine is clear, then obviously that's not due to a UTI. Now, some people can have what we call asymptomatic bacteriuria, which means that there's bacteria in the urine. And so it's colonizing the bladder, but it's not actually causing an infection because there's no white blood cells and there's no inflammation. And in that situation, some people may require longer term antibiotics. But when this kind of bacteria in the urine will not be causing those kind of pain. So the pains people can have, like I say, asymptomatic bacteria can have some bacteria in the urine, but it won't be the cause of their pain on a chronic basis. In terms of functional medicine testing, I'm very careful I urge people to be careful of accepting a lot of the testing that's done in the, excuse me, in the functional medicine world, because a lot of these tests are not actually accepted, and I don't believe that they're actually accurate. So I think people have to be warned, because frequently the people end up getting scared and being frightened that they have all this horrible bacteria or parasites or all sorts of other diagnoses that cause fear and actually make people worse. So the key again goes back to the assessment. And when the symptoms are shifting, moving, turning on and off, related to stress, related to innocuous triggers, and we can show that, then you don't have to worry. You really can ease your mind and stop worrying about all the fears that kind of come up.
Yeah, it's true because I have people that come to me and they say to me, I just got my test back. I have this bacteria that they found that was hidden. And we go through a little bit of an evidence-based questioning, and they maybe just went hiking that weekend. And I said, did you have your symptoms then? And they say no. So did the bacteria stay home then, or did it come with you on the hike, right? So they start laughing usually, and it starts to click in the brain,
Yeah.
that I don't have to have pain with having this bacteria that might show up with some, test that a functional medicine doctor did.
Yeah, so many times people just like, I love how you phrase that, because they say, well, it's heavy metals. Well, the heavy metals are coming and going, or the mold is coming and going. I mean, it's, when you have a disease, you have something wrong, and it'll be there until it gets fixed. But
Exactly.
the beauty of the brain is not trying to harm us or betray us or hurt
Right.
us. It's actually trying to protect us, which means that it's afraid or frightened. It's worried that there's something wrong, either emotionally in our life, or it's worried how we're responding to the pain itself with our fear and focus on it and worry about it, etc. And so the brain will give us these clues, and it'll help us to see that it's actually not a structural problem by turning it on and off, by making it inconsistent, by making it spread, by making it move around, by making it triggered by innocuous things. And when you see that, then you don't have to worry.
I know it's fascinating what the brain does, right?
Yeah.
It's absolutely fascinating. So I'm just curious because a lot of women and men have urinary frequency, urgency, bladder pressure. And I'm just curious, what techniques have you found to be the most successful with that?
Right. Well, the first thing is to understand that if you're peeing every 5 minutes or 15 minutes or half an hour, then it's not because there's that much urine there, unless you're drinking a ton of water and a ton of caffeine. But if you kind of just drink normally or even limit fluid intake for a few days, you'll start to see that there'll be less urine. And when there's less urine, but there's this urge to urinate, you have to realize, well, the bladder is controlled by the brain. And the brain has all these nerves, the sympathetic and parasympathetic nerves that go to the bladder that make us have this urge. And so the urge is a sensation, but it's not due to the bladder being abnormal or damaged or totally full. It's a sensation. And if we can learn that it's a sensation and that it's harmless, then we can begin to take away our worry about it and fear of it and having to do something. And the panic that we get then makes it worse. But if we take away the panic, we can often begin to step back and just feel that sensation and be with that sensation. And everyone knows they have the ability to hold their urine if they're in a long line. I mean,
Exactly.
everyone's done that. So it's really using skills that people actually have.
Right. One of the things that I will do is I'll use some of the techniques that, I've learned in your training. And before even they go to the bathroom, stand in the mirror in a powerful pose, say, let them know I'm okay. And then even just putting their hand on their bladder, thanking their bladder for doing its job and that it's healthy. And then even after they go to the bathroom, have them even lay down for even 1 minute and just do a little meditation, a loving kindness meditation with their bladder and sending them messages of safety, I know has been very helpful to a lot of my clients.
Yeah, yeah, absolutely. Yeah, there's so many ways of calming our brain. And like you say, it has to do with compassion and love, it has to do with understanding, reassurance, messages of safety, messages of empowerment, using humor. We just peed 10 minutes ago. It's like, I really don't think this is a problem now. And just
Right.
being able to laugh at it can really be helpful too.
It's true when we can laugh at our symptoms and but not like as, making fun of them, but being like, oh, this is silly, you're okay.
Yeah.
Just giving yourself those messages of safety, continuously can really make such a difference.
Exactly how we would treat a child who's fearful
Exactly.
of a monster in the closet or putting their face in the water. We want to help them, reassure them, and love them, and then kind of cajole them, like, yeah, let's make a game of it.
Exactly. Exactly. So now I have a lot of clients that have had a physical thing happen to them, like they've had sex and had a tear, and the tear heals, and they're still now having pain. And I've also had clients who've had different surgeries and they were okay. And then a month later, the pain started. So they think it was a botched up surgery and the nerve is damaged.
Right.
So I'm just wondering if you could speak on that a little, why there would be pain after the injury is healed.
Yeah, for sure. So when there's an injury, the brain creates pain. And actually, an injury doesn't cause pain itself. An injury sends signals to the brain, and then the brain can create pain. Usually it does when there's an injury. So that's number one. Number two, once the brain has created that pain, it will learn it, and it will remember it as a neural circuit in the brain. So that pain can recur at different points in our lives because the brain knows how to do it. It's kind of like it knows how to ride a bike. You get on a bike, your brain remembers how to create that pain. And at different times, either with another injury or with another stressful emotional event, the brain may turn on that pain. And all injuries heal. So
Right.
the body heals, and all injuries from surgery heal, all injuries from tears and strains and pulls heal, all injuries from assaults physically heal. And so it's really important for people to understand that. Pain that, and then it's classic, as you pointed out, pain that occurs after an injury is healed is clearly a mind body condition.
Correct. Yeah. Thank you. Thank you for shedding light on that. Now, I'm curious if you have any thoughts. I have a lot of women and men in this community who have PGAD, persistent genital arousal disorder. And I'm just curious if you could say anything about arousal versus pain. Are they the same?
Yeah, that's a great question, and it's a really important topic and an important condition, and a very distressing, like super distressing condition. We've treated many men and women, particularly mainly women, though I think, with this disorder successfully using our mind body approach. The arousal is a sensation. Arousal has to do with how our brains react to things in our body and things in our memory and things in our environment. So all those inputs are coming into the brain, and the brain can turn on pain in certain situations, as we discussed, but it can also turn on arousal, which seems really distressing, but it's a normal part of the brain's function to turn on arousal. I mean, it's part of what the brain knows how to do and is good at doing. And these circuits then just tend to become learned and reinforced, and they often get reinforced because of how distressing and annoying it is. And the more distressing and annoying, that sends signals back to the brain, and the brain is going, oh, big problem, and it makes it worse. So this vicious cycle can occur. And, it's the opposite of people who are unable to get aroused. That's also a brain related phenomenon. And so these are all on the continuum of things that our brain produces, and they are sensations. And the sensations are not dangerous, they're not harmful, they're annoying and distressing. But if we can learn to treat them in different ways, think about them in different ways, and deal with any underlying emotional issues as well, then people can get better, and they do.
True, true. I find that just sending a lot of compassion to this part of the body is just so helpful.
Yes. I think in the end, a lot of our work is really about compassion. A lot of people who've had difficult childhoods or difficult situations in their life tend to blame themselves, be harsh with themselves, be critical of themselves. And changing that narrative is often one of the key points, key parts of recovery.
Exactly. Now, I have some clients that say to me, how could this be mind body because it hurts so much?
Yeah.
And I it's hard to explain to people sometimes. So I wanted you to explain it if you could,
Yeah.
why something, why could it how could it be mind body if on a scale of 1 to 10 it's a 15?
Yeah, I know it's horrible. The reason is that, as I said before, our brain, when we have pain or other symptoms, it's because our brain is generating them. An injury can't cause pain, it's the brain. So when you have a kidney stone, it's the brain causing pain, even though there's a kidney stone. And that can be 10 out of 10, 12 out of 10, 15 out of 10 pain. Childbirth, labor can be 10, 12, 15 out of 10. And the same can be true of mind body pain. It can be 10, 12, or 15 out of 10 because all pain is generated in the brain by the same parts of the brain. So when you get an injury, certain parts of the brain light up that generate pain. And when you get a physical injury, when you get an emotional injury, the same part of the brain lights up, generating real pain. So all pain is real. All pain is created by the brain, and it can be severe, persistent, and extremely annoying. But when it's due to neural circuits in the brain, it is reversible.
Yeah, I tell my clients all the time, if you can have a physical injury and it hurts like a 1-2, and you can have a physical injury that hurts in a 10-12, why can't you have a mind body
Yes,
condition that does the same thing?
exactly.
Yeah. Now, I'm just curious if you've seen a major correlation with personality in regard to the pelvis.
Well, certainly we see these types of personality traits all the time in all mind body conditions, including pelvic pain syndromes. And they are perfectionism, uh, overly conscientious, self effacing, doing everything for others, putting themselves last, never saying no, never standing up for themselves, feeling a lot of guilt, feeling a lot of blame, being self critical, harsh with themselves. All those things make the brain feel so much more endangered, and we have control over those. And so those are often one of the most important parts of helping people to recover by changing that narrative.
I just had like one more question anyway. Physical floor um, pelvic therapy,
Yeah,
pelvic floor physical therapy.
sure.
What's your take on that? Because I know a lot of times, Dr. Sarno has said stop all physical things. And I'm just curious what your take on this is for the pelvic floor.
Yeah, I think it really depends on the person, the situation, and the pelvic PT person. So some pelvic PT people can be extremely kind and caring and reassuring and do gentle movement stretches, exercises that help people realize that their body is actually healthy and strong and normal. On the other hand, sometimes PT can be invasive, can be harsh, can be painful, can be by somebody who's emphasizing how everything is damaged or broken or too way too tight or whatever. And
Mhm.
so if it's the former, I think it can really be helpful. But if it's the
Right.
latter, I would suggest not doing
Yeah,
it.
as long as they know it comes from the brain.
Right.
That's
Yeah.
where it's coming from. I always tell people too. But
Right.
thank you so much for joining me today. I really appreciate you answering all these questions about the pelvis. I know it's going to help a lot of men and women out there. And just if you have any other closing words, I'll let you finish.
Oh, I just love what you're doing. I just think you're doing a fantastic job, and especially the emphasis on self-compassion. That can make all the difference in the world, and helping people to know that they're really not damaged, they can recover. So there's hope, and that's the key.
Yes. And thank you so much for what you do for everyone and what you've done for me, because I wouldn't be here today without you.
Oh, you're welcome. Those are kind words. Thank you.
Thank you.